This morning, it's my honor and pleasure to introduce Alan Lieber, President of Overlook Medical Center, a part of Atlantic Health Systems. Good morning, Alan.
Good morning, Mark. It's great to be here to help tell our story.
Let's jump right in.
The COVID crisis has been a challenge at many levels. And here at Overlook Medical Center and throughout Atlantic Health System, we had just an enormous challenge back in the spring. We kind of look at this as we think about this as the 3 R's: response, recovery, and readiness. First phase of trying to respond to an unknown crisis just took an unbelievable effort from our frontline workers and from all of the rest of the system to support. Even more striking was we had to move from we have 40 critical care beds here, and we hit a maximum of 109 critical care patients. So we had to do everything we could to create critical care beds within the space of about 3 weeks. We had a lot of support from our system, Atlantic Health, and we brought in some people resources when we needed to do that. And overall, we've now taken care of 1,130 COVID positive patients as inpatients and several thousand more on an outpatient basis. And so we're just very proud of what the team was able to do in a really short period of time. Quite honestly, we turned the hospital back on to take care of people. And while it wasn't this crisis in front of us, their team really came together to make it safe and comfortable for all of our providers and for the patients. So incredibly proud of our team for coming together to do that also. And we are running pretty close to what our normal levels are right now. I think as we move forward, we're anticipating there may be wavelets, which means we have to be able to run the hospital coexisting with COVID and non-COVID patients. I have to say the state government here, the governor and the commissioner, Judy Persicelli, Commissioner of Health, have been really good partners and I think done an excellent job of coordinating policies and responsiveness across the state. I just want to talk about the laboratory industry. So the laboratory industry's response was simply remarkable between February and April, because here's a new entity, new disease. They figured out how to test for it, and accurately, really rapidly. From April till now, it's been a disaster. And so there's a real issue about adequacy, adequate availability of testing. And in my mind, there's the lack of having a national orchestrated plan to this is really problematic. But we're going to have 7 lab testing platforms here by next month, and to do COVID testing, just to do COVID testing. Why so many? Well, the issue is we can't count on getting the reagents from the companies to run the test. And so that has created enormous amounts. I can't tell you how much time we've spent on algorithms about when we're going to use one test versus another test and which patients. And we can't count on that and they change. And it depends upon what's happening nationally. So it's sort of unfathomable to me that this country couldn't figure out they figured out how to do the lab testing, but we haven't figured out how to provide the chemicals to run those lab testing. And I just think it's I think we need some national organization around some of these things. So anybody listen to me, that we really need, we need to look at the whole chain of events, not just the innovation side. I do think the response from our frontline teams, from our support teams throughout the Atlantic Health System, and from the community has been remarkable. And, it's been inspirational. I was inspired by what I saw everybody else doing. I just want to thank everybody who rose to the occasion. Mark, thanks for the opportunity to share my story.
Thank you very much for your time this morning. You've got important work to do back there at Overlook. You'll get back to work, and we'll look forward to talking to you again soon.